Hi, this is Colleen Parsons again with part 3 of your nose, mouth, and throat assessment. We are not going to be inspecting with palpation the inside of the mouth or throat. We're only going to be looking inside, and we are going to be palpating and inspecting the entire outside. So we don't need tongue blades and we don't need cotton gauze or gloves for this, but you will need an otoscope or your pen light. There's something else that we won't be doing here, and that's the transillumination. It's an interesting thing and we're going to cover it, but it really isn't necessary for your skills check. So inspect and palpate. You're looking for symmetry again, just like everything else. You're looking for any deformities, any lesions, skin lesions particularly, but anything that's inflamed. When you get into the actual palpation, you're going to be touching your partner's sinuses, and you're going to be asking what? What do we always ask? Do you have any pain or tenderness as I touch you? Let me know. You're going to be asking if they have a sense of smell, which is cranial nerve 1. That's not usually tested on a routine examination, but we are going to use it here for our purposes of our skills check. So you're also going to be inspecting the mucosa, the nasal cavity, the septum. You're looking for deviation to the septum. I have a slightly deviated septum. Some people have a grossly deviated septum and require surgery. So here's looking inside the nose, but we're not going to use any tools. We're not even going to put a speculum up there. We're just going to put the pen light there and see if there's any discharge or drainage coming down. Transillumination means that you take a pen light or some kind of a light and you put it through the sinuses so that you can see if it will shine all the way through the sinuses. And the theory is that if it doesn't, your sinuses are clogged. However, I want to say it's something like 40% of the time it won't work anyway. And so we don't even do that. We don't ask a person to tilt their head back. And while the other class may actually do the transillumination, I am not using it for this class. It really doesn't help you learn anything from my perspective. So we're inspecting the sinuses. We're looking inside the person's mouth. We're inspecting the teeth, gums, and you're reporting on the condition of the teeth and gums. So if there's decay, as some of the students want to say, their teeth are rotten or I see no rotten teeth, you don't want to use that word. We say decay. So we want to use, are your patient's teeth free of debris, which means they've been brushing regularly? Or are they crusted with tartar and plaque? So we want to say those things. We can also tell some people bite the inside of their jaw, or their cheek, or their lower lips, and we want to know if that's going on. We also want to see if the person has been using chewing tobacco or anything that they might be keeping in the pouch of their cheek. So normally gums look pink or coral. They might have a little bit of a dotted surface, and we want to make sure the gum margins are tight and well defined. You will see with African Americans that they are very often, or dark-skinned people, they are very often a little bit darker along the gingival margin. We're going to inspect the tongue. Is that free of debris? Is that discolored in any sort of way? Is that symmetrical? Can the person touch the roof of their mouth with their tongue? That's one of your nerves. And then we won't be doing the rest of this. as far as using the gauze, but we do want to visually inspect the palates for any lesions or any problems going on there. Mouth cancer is a big deal. So we're looking for anything unusual in the tongue, mouth, cheeks, or throat. We want to inspect underneath the tongue and behind the teeth for malignancies or for any possible cancers of anything, especially in patients who are older than 50 and have a history of smoking. So you would hold the cheek open with a tongue blade, but we're not going to do that. And of course, this is always for a more focused assessment. The Stetson's duct, make sure you know where that is. The opening of the parotid gland is where it is. Looks like a small dimple inside the cheek under the second upper molar. So you can feel it with your tongue. Most people can. And what else do we want to look for here? You're really looking for normal, 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 normal. That's what your job is to understand what normal is, so then you can report out what's abnormal. So look in a lot of people's mouths. It might seem weird at first, but the more times you look in people's mouths, the more comfortable you'll be with it. So you're going to normally, then you're going to look inside their mouth at their throat. You want them to say ah, and you are looking for the uvula, the little thing that hangs down the back of their mouth, throat. You want to see that rise equally. It's going to be midline when it rises. And that's cranial nerve 10. I don't know if you all know your Roman numerals or not, but that's good to review those if you don't, because a lot of healthcare uses Roman numerals still. Tonsils are graded or sized this way. So 1, you can see them. They're just barely visible. 0, of course, would mean that you don't have tonsils. 1 is that they're visible. 2 is that they are about halfway between the uvula and the side of the throat, which is called the pillar, tonsil pillar, where it's holding on. +3, they might be touching the uvula or almost touching, and +4, they're occluding the throat and almost, and actually almost touching each other or touching each other. You will probably see 1 plus or 2 plus. Some people actually say +1 and +2. That's more location, I guess, wherever people studied. But +1 or +2 in normal healthy people. So most of you will see that in the people you look at, unless you start looking at people over 50 who likely will have had their tonsils already removed. So here's a good example of 1, 2, 3, and 4. So 1, 2, 3, and 4 here where they're touching in the back. You can still swallow, but it becomes really hard. Now see these little cavities here in the tonsils? They get tonsil stones in them that can be expressed. So if you would, especially if somebody has had frequent tonsillitis, tonsil infections, you can put the end of the toothbrush on those and push on them, and those tonsil stones will actually come out. They're not harmful, they're just there. Oh, when you are inspecting the throat, you're also inspecting how the breath smells. And we're looking for, of course, bad breath, which is halitosis, that can be caused by poor oral hygiene, or when somebody ate garlic or something else that was really smelly food. Alcohol can cause, smoking will definitely cause a smell. Dental infection will cause a smell. But we're also looking for something, a smell that might be fruity, that might be an indication of diabetes or something ketoacidosis or something along those lines. So you are to report on the smell as well. And many students forget to do that with their skills checks, so don't you forget. How infants and children are different. The best time to actually check a child's mouth and throat is when they're screaming, especially when they first get into the doctor's office, usually when they take their, when they're being disrobed for the physical. That's a good time to look in there and make sure everything's okay. And you won't be really checking on any newborns at this point. So we want to make sure when it's a brand newborn, this will be next year, that those nares are free of debris and that you've suctioned them well to get all the amniotic fluid and birth contents out, like meconium or any vernix that's stuck in there. As the child grows, you want to check on how many teeth they have. Do the teeth seem to be developing normally? And if not, and also the level of decay, if there's any decay in those teeth. If the mother is giving the baby a bottle and letting the baby fall asleep with a bottle in the mouth, especially either milk or juice, then that's going to encourage decay. Saliva, are after 3 months old, is that baby producing saliva, and which will increase as it will be much more present when the baby is actually teething. What you want to say is your baby drooling, and or you note it. And we want to be looking at tonsils. If it's a small baby, an infant, especially a newborn, you want to see if that baby's sucking and how that feels. While you're doing that, you're also palpating the hard and soft palate to see how that's working for the child and if that's all intact. And in the older adult, we are inspecting for the teeth are most important. They should be yellow. As a person gets into their 50s and 60s, there's a lot of theories out there about how important it is not to use whitening on your teeth because it erodes the protective surfaces of your teeth. It actually wears off the enamel. Might be bleaching the teeth just fine, but there's a thought to that. Teeth may look longer as the gum margins recede, so you're looking for the gums receding. That does happen. And then your sample charting notes. And don't forget that you'll be writing or preparing an ISBAR at the end of your skills check. So these are just some abnormalities that you'll find in your textbook. They're kind of interesting. You want to see a cleft palate. You want to see a bifid uvula. That's the end of part 3 and the end of your lecture for nose, throat, and mouth. Thank you very much.